So good afternoon.
Good afternoon.
We are here to share with you our story. So we're returning a bit to the COVID pandemic. It was mentioned already a lot of times, but we will focus mainly on COVID and what the work of our company, GGD Regio Utrecht, which is one of the 25 public regional health services in the Netherlands. Let's introduce ourselves. Erna.
Erna Jansen, HR advisor at the Corona company since September 2020. And I heard Cyril saying something about a guilty pleasure, so I thought I'll introduce myself by that. I like singing along the music in the car, so that's why my voice is a bit grumpy at the moment.
Very good. So my name is Maaike. I work for the GGD as a manager for the COVID vaccinations and the contact and trace and outbreak management departments we currently have. My guilty pleasure is listening podcasts while riding my bike to work. So if you have any good suggestions, please let me know afterwards. We're going to start where it all began. You can see the headlines, newspapers, the pandemic starting worldwide, but also for our region in the center of the Netherlands. And we want to share a few moments from a documentary we made at the first part of the pandemic.
De realiteit is dat het coronavirus onder ons is en voorlopig ook onder ons zal blijven. Er is geen eenvoudige of snelle uitweg uit deze zeer moeilijke situatie.
Ja, de eerste besmetting in de regio, dat weet ik nog goed, dat was in Houten. Toen ging echt bij ons de alarmbellen af. Hey, nu moeten we echt aan de slag. 24/7 beheerst dit onze wereld.
2 weken, 3 weken na de eerste besmettingen zagen we het aantal zo snel toenemen. Normaal gesproken met ons team doen we 1 of 2 bron- en contactonderzoeken van andere infectieziekten per dag. En nu moest je er dan 10 op een dag doen, want er waren 10 nieuwe besmettingen elke dag dus en niet per week of per maand. Dus dat moest allemaal heel grondig gebeuren in een onbekend terrein.
We moesten broncontactonderzoek doen, we moesten mensen te woord staan, maar hoe dat allemaal gedaan moest worden, dat was heel wisselend. Het was elke dag maar de vraag, waar word ik vandaag op gezet, welke onderdeel? Het is echt maatwerk van wat kan er op dit moment.
Uit de beginperiode wat me meest is bijgebleven zijn de verdrietige telefoontjes. De mensen die dierbaren hadden verloren en die een begrafenis moesten regelen met hooguit 6 man of nog minder.
Zorgmedewerkers, jeugdtrainers. Vanaf vandaag komen daar de leraren en de medewerkers uit de kinderopvang bij.
Wij kregen tegelijkertijd met de mensen thuis te horen in de persconferentie wat het testbeleid voor de volgende dag zou zijn. En dat duidelijk maken soms aan de mensen was heel lastig. Want ik dacht op de een of andere manier toch dat wij al informatie vooraf hadden. En dat was dus niet zo.
Yeah, it's a nice documentary. You can see it at our YouTube channel, but we like to share with you a bit more in person. And it was the first part. Later, the pandemic evolved more. So I'll share a bit of the background we had while starting our startup, and then Erna will continue with more the HR perspective. And as you can imagine, where it all began, we are now a bit back 1.5 years ago. It all started from crisis management. We do have a team for that 24/7 available because infectious disease control is one of the main tasks a public health service needs to do. We are obliged by law to do. So when this first infection, the positive COVID patient, was in our region, the team gathered and they started from their crisis management perspective to make sense out of a situation. In addition, the infectious disease COVID was mentioned an A disease. It had a different status which changed the government structure for infectious disease control. And the national government gave us assignments to carry out testing and tracing for this new disease that confronted all of our lives. So crisis management was the first we did 24/7, and one of the main things we needed to do was trying to make sense out of the situation, which was highly uncertain. which also meant that our employees, because every citizen was anxious, so also our employees were anxious about what is this going to be and what is going to happen. And in that time, the Minister of Health said to us, you will need to test and trace all inhabitants, of course in our region, thankfully we are with 25 regions, all inhabitants starting June 2020. So when we heard this, we decided this is not the moment to be in the GGD, which is our regular company, but we decided we need to have a dedicated company for this task, for striving the pandemic. So we call it the Corona Bedrijf, which I will now call Corona Company, I guess. But it's a part of the GGD, but it's separate, it's in a different building, and we're working with all departments on striving the pandemic. And we have 3 main goals. It's to keep an eye on the virus, keep track on the virus by testing and tracing, to protect the vulnerable people in our region, in our community, and also to ensure that healthcare still will be on an acceptable level in our region, so care can be given to people. So in June we got the testing and tracing for all inhabitants, and in December last year we got the vaccination assignment to start vaccinating a lot of inhabitants in our region. And as you might have heard last Tuesday, there will be another assignment coming the next month. But this was the beginning and the start for our Corona company and starting a new adventure.
Thank you. As Maaike just said, in March 2020, all employees from the public health services started fighting the pandemic. Not only nurses and doctors, but also the financial department, receptionists, all the people of the public health services. And they were really devoted to get the pandemic under control. But after 3 months of hard working and devotion, it was no longer to be done by just the company, the GGD. They had to start with another company, as Maaike just said. And that's what they did. They decided to look for a supplier for people, job agency, to scale up in a short time. They built in a 3 months' time a Corona company of 1,000 people. So if you think that the GGD already has 750 people aligned, then it's quite an increase in such a short time. And when I started in September 2020 as a HR human resource advisor, they told me that it was not going to be ending at the end of 2020. So we had to work to become a mature company. So I had 3 assignments. I had to build a role building, which we had to build just in a short time. So I couldn't ask for advice to the Labour Council because we had just a couple of weeks. So we benchmarked all the roles up to the external market and also to the internal job structure. And I also had to negotiate with the supplier again because at least another year we had the Corona company with us. And for sure, when people are with you a couple of months, they have personal needs. So we had to tie them to the job to be sure they won't walk away because we had that many people walking around. So we did some research about their personal needs as well and gave them guaranteeing working hours to let them stay with us for another couple of months. From startup to scale up, in less than just 1 year's time, we built a Corona company from 1,750 people, and I heard some figures already earlier this day, up to 7,500 people working with us. So it is really a great amount of people. And as you can see on the sheet behind me, we had our own testing and our own tracing departments, also as our own local call center. That's one thing we wanted to have. Because if you look at the figures and seeing the testing, about almost 1 million tests will take 7,000 hours of people to do this. And if you look at the research and contact center figures, we need around 75 people per shift per day, 7 days a week, to get this done. And if you talk about the call center, it's not only about making an appointment, because when it was just making an appointment, it will be taking a couple of minutes. But it's really showing empathy, really listening to the people. That's what our employees needed to do. So a call just not took 1 or 2 minutes. It took at least 5 or 10 minutes to come through, and afterwards making an appointment. So a lot of people working in this company, and I was wondering, you heard some figures now, if you can tell me how many different roles we do have in the Corona company right now. So you can open your Slido and help me whether you know how many roles we do have in the Corona company at this point. Some people do know already. There's another GGD in the room.
Well, maybe
Yes.
you can say.
Yeah, it's right. It's 80 roles at this moment we have in our Corona company. And it's a really big amount of roles. And we had to develop this in a year's time, as soon as we knew it would last longer. We started differentiating. We started the specialization, customization. We need to gain higher standards. And we have also had to put on data-driven approach, as well as being more innovative. So a lot of things. And one spontaneous thing is, as we required immense growth, we focused at first on our educational levels and competence, instead of the experience people have or the previous functions they did. And this is because our newly acquired staff were posted in roles that didn't exist before. They weren't there before the Corona company. So by means of selecting people, mostly based on competence, we spontaneous, inclusive and also diversity organization came to life, where a lot of big companies are jealous about. And a true expansion of employees, as you can see behind me, from students to also retired people who helped us with different backgrounds, different multinationalities. I heard 38 before, but it was in our highest time about 60 nationalities in our company, and everyone with their own language and their own preferences. But despite all these differences, what they did was a really good job, and they motivated each other to get the pandemic under control. And we're still not there yet. Their commitment resulted in desired roles, and with the company, in desired roles with the company, and their enthusiasm leads to the roles they are fulfilling today.
Yes. We're going to the next, because we saw this crisis as a chance. You know the phrase said here, when life gives you lemons, you can make lemonade or limoncello or whatever you like, but you can at least take a chance out of something that might be a crisis or might be frustrating or might be difficult. And so we took, as a Corona company, we took this crisis and are scaling up as a chance to celebrate life and enhance things we already wanted from the GGD perspective also within this company. So one of the things is that we focus more on inclusion. As Erna said, we have a large and diverse and inclusive Corona company, but also when people are leaving our company, we now give them the option to have a certificate that they worked for us with the option for a neuter gender on it. In addition, we're not only celebrating the traditional Dutch holiday seasons, for example, Christmas or Easter or Sinterklaas, but also there were employees who asked us, could we also do something for the Eid al-Fitr? Or could we also do something for other things? Or can we celebrate that we are now already with 2,000 employees working here, or that we did the first 1 million vaccinations with our employees? So we like to have small celebrations with cake or little gifts or things coming from our employees, but also from our management perspective. We encourage all our people to do service with a smile because it's a difficult time. We also get difficult people in front of us by phone or at locations, but yeah, they all are really driven, motivated to be hospitable and give a good experience to the people who are coming to our organization. We focus on quality and innovation, so there's a chance to be innovative, to test new systems, to work with new applications. And one of the things we like best is 2 weeks ago we organized a big party. It's called GGD Bedankt, to say thank you to all the people who worked for us this 1.5 years already. It was sponsored by all the organizations we worked with during this last period. It was in the Jaarbeurs in Utrecht, so it was big, and it was really nice to have all these people together, saying thank you to them, and also encouraging them to keep on going on for a little while. We go to onboarding because that's what we're here for as well. And what is interesting is that we had different perspectives for onboarding, from a management perspective and an employee perspective. So Peter mentioned some of the C's. They were originally 4 and now 6, I think, which are also in our management requirements for onboarding. But what was interesting is that our employees also had a bit different perspective, because at the start of the pandemic, a lot of people, you might know them, wanted to join our company because they wanted to strive the pandemic and fight for the good cause, and they wanted to also do it on a voluntary basis. We do not have voluntary people working for our company. It's all paid work because we want to have this quality. We want to train them. We want to have them motivated. I will not say this cannot be done by volunteers, but it's easier if they're not voluntary and paid workers at the time. So how did we do this onboarding, Erna?
Well, I heard before already a lot of different kinds of onboarding, and as you all know, we had to work at the locations. So we did start with the hybrid form of onboarding. We first of all let all the people come through the Apple app by doing self-study, and after that they had to be trained live by health service employees or skilled teachers, and case studies per team or department. And we did that on a hybrid way, because the case studies we could do in the Apple app, and the other things we had to do at the locations. We therefore focused on the particular roles. I already told you 80 roles, so there was quite a lot of work to do to get this all in the app, and that's why we made an app with all the different departments, and all the different departments had their own platform. So furthermore, they were trained also on the job and coached by people who already had the experience and are qualified to do the screening of skills. And they needed also to be authorized to sign a certificate of competence, because all our people did not have the right background, so they need to be on the location and need to be screened. A lot of investment, of course, in all the different roles, but for sure to boost the people up to an 8, because that's what we wanted to have in terms of quality. And we also did some cross-boarding, also by the help of Epical. In the past months, many people have been able to do more than one job. They started with one specific role, but after that, they did their first, their second or their third role. And some people are also working in combination roles. Not just because we wanted that, but also for the diversity in work, the variety in work, and on the other hand, to give them the challenge to develop along the way by working with the GGD. And which we did really stimulate that. We did that by, I've never done this before. I think I can do it. You all know Pippi Longstocking, and that was our guiding principle. Because after all the roles didn't exist. We give them trust and we give them confidence, the words I heard before on all the presentations as well. And we give them involvement and devotion to make it a success. And this all contributes towards cross-boarding in our company. And don't get me wrong, as none of us wanted this pandemic, but with a new colorful CV and a bucket load of experience, it's good to see we can stimulate our people in their development and that they might be able to get a return on the job market again with the renewed chances and possibilities. And I'm very proud of all the people working with us and worked with us and come through our onboarding program.
So how do we go on then from here? I'll briefly show you that we are still vaccinating. We had 36 locations in our region. We're trying to be as close as possible to the people now to remove all barriers for them to get vaccinated, and about 80% in our region is now vaccinated. We still want to make the difference in our region for the people. So for example, you see here this beautiful traditional clothing. We did a testing pilot in this community, but we are also working with welfare organizations, and we're the first public health services to help the Department of Health with the international vaccination papers. We are a lot of times in media. I will skip that part because I'm curious to hear your answer to this question. It's in the Slido. We just put up some periods. When do you wish it to be ending? No, when do you think will be the end? Ooh, that's a large amount of people think that it will be among us for a longer period. We do think the same, yeah.
Yes.
We don't know when it is going to end. We do know it will end in the way it is now, but we also know from the doctors that work with us that it will be for a longer period of time among us in this globe. So that will also determine our future. We're still working as a corona company on this pandemic. We still have assignment from the national level. We are scaling up and scaling down. When the minister sends out his tweet that we are going to vaccinate this and this persons, we know by then we also need to do this. We call it GGD Connect app, which is an application, a communication platform, which is connected to Epical to be in touch with all the people we have remote on the different test and vaccination locations. And we are hoping that we can end our company at one day, but for sure it will be a part of the public health service in the future. We have a lot of final tips and tricks for you. I did not mention the ad music, but we had during our vaccination process in the Jaarbeurs in Utrecht a nice cooperation together with Tivoli Vredenburg, so the musicians could come to our location, and the people that needed to wait for 15 minutes after their vaccine could enjoy some nice music. So another chance to celebrate and to make the lemonade out of the lemons. So make a dedicated company, give trust to the people, and that's it, I think.
That's it, right.